Hello, good afternoon, everyone. We are back with one another live session and very interesting live session, I would say. We are just waiting for the guest to join us. Meanwhile, hi Shrishti, hi Mansi. I hope you all are doing good. Before ma'am joins in, uh, let's have a chit chat over the topic. Today's topic is integration of cosmetology in homeopathy. We are just waiting for ma'am to join in. Hello, good
Hello,
afternoon, ma'am.
good afternoon. Am I audible to you?
Yes, ma'am. Audible.
Yes. Yeah.
Okay. Good afternoon to all the viewers. I am Sneha Singh, Bijan Campus Ambassador, and today I am welcoming our esteemed speaker for the day, Dr. Smita Bhoir Patil. Ma'am's name need no introduction when talking about her. From on being such a small age, she has led a foundation of an often good integration that homeopathy at times demands of, that is cosmetology in terms of homeopathy. So, Dr. Smita was the first to design a specialized course in homeopathy cosmetology across all over the India. She was the first practicing teaching homeopathy, cosmetology, dietetics, and nutrition from last 14 years. She is founder director of Peachtree International Academy, Peachtree Skin, Hair, Weight Loss Clinic in Pune. Dr. Smita's pioneer work in homeopathy cosmetology has inspired thousands of doctors to follow her footsteps and get trained under her guidance. Her expertise and is being recognized by certified celebrated figures from the Marathi films and television industry. A homeopath having 8 lakh plus followers on her social media accounts and celebrated figures taking holistic care of homeopathy is a proud moment for all the homeopaths, as it is a testament of how far we have brought homeopathy today. So we are very lucky to have you for this collaboration, ma'am. The topic was quite amusing for students like me, but who wants to know how cosmetology and homeopathy works hand in hand.
Right.
So the stage is all yours, ma'am.
Yeah. First of all, thank you for having me. And I'm just hope that this today's session will provide some new information to our students and practitioners who are attending the session. Because when it comes to cosmetology, it is always exciting to us. And that is why if you see, like many doctors enroll for cosmetic courses like PGDCC or trichology, right? Feeling that there is no scope in homeopathy for cosmetic procedures. So that is why they enroll for other courses. Even I have visited a few colleges before starting this course, and I asked how many of how many students wants to practice homeopathy. Hardly, I think 20%. Two, three colleges everywhere like same picture. People don't want to practice homeopathy because they feel that there is no growth. Maybe, like practicing homeopathy is very difficult, and there's a lot of like waiting time to, when like actually they start earning. So many questions they had that, and because of that, they don't want actually to practice homeopathy. So that is the reason that, I thought of, because see, adding extra skills to your knowledge, like whatever you practice, is of course is going to upgrade the way you practice, and plus for new practitioners also, it is for both doctors who are already practicing, because they somehow sometimes, they also get discouraged. Uh, at the end, everybody wants, to see better results, and plus, of course, money. So for these two aspects, and they have that fear also, that whether homeopathy will give the results or not. So many things are there. So this is just, if you have additional skill, so at least you will stick to homeopathy.
Hmm.
At least, along with your existing practice, you can do this. And when, because other doctors, if you see, when they go into cosmetology, they don't practice homeopathy. Then they are just a
True.
cosmetologist.
Huh.
Yeah.
Yeah.
They don't want to practice, or they don't want to go into homeopathy. But then once we started this, no, so I realized that homeopathic medicines are actually more effective
Hmm.
than what the conventional, way of practicing is. So this is what I wanted to even teach students, that this is what you can also do at your practice. You can like build your career. So many, I hope, like many questions you must be having, because this is something new, and we can go ahead with the questions that you have.
As you mentioned, ma'am, many questions. I have noted a few for you
Yeah.
because I was too curious to know about this
Yes,
integration
yes,
of cosmetology and homeopathy.
yes.
So I want to start with this question: that what is the current scope of cosmetology in the field of homeopathy, and how can a BHMS student or practitioner benefit from it?
Yeah. So we always know, see, cosmetic is all about external appearance, right? How you look. So the skin diseases are different, but these are like just how you look. One concern, if we see, like acne scars, or pigmentation, uneven skin tone, melasma. So these are like cosmetic concerns. And for hair, like hair fall, hair thinning.
Yes.
So scope wise, like when patient goes to a conventional practitioner, they only treat that patient symptomatically. Okay, but then for homeopaths, like we take detail, even like patient comes for the pigmentation or melasma, we take detailed history. So we try to treat the patient holistically, even though it is a cosmetic concern. So patient get like long-term treatment, like long-term results for the, whatever concern they have. And another thing, scope-wise, if you ask me, it is these are safer treatment. Everybody wants, they want to go for the therapies, but then they also want it should be safer. It should not have any harmful effect. So
Yes.
scope-wise, definitely a good scope, and eventually it is going to grow. People will be looking for safer and holistic kind of treatment for cosmetic concern as well. So definitely for homeopathy, scope is good.
Okay, ma'am. What kind of results can typically we expect while choosing homeopathy for skin, hair, or cosmetic concerns?
Yeah. So, result wise, I would say, see, every pathy has a limitations. But basic things, as I said, uneven skin tone, mild acne scars, pigmentation, melasma, which is actually very difficult to treat with conventional thing also. But in homeopathy, because we have internal medicines as well, so it is actually difficult, like, sorry, easy to treat with homeopathy. So definitely, I'm going to answer like how what usually we do in cosmetology, but we have internal plus external treatments. We have so many medicines to give for melasma. We have so many medicines for just to treat pigmentation problem, even acne scars. So results are generally either equal or even better than the conventional procedures, and we have been doing that since many years. I think 5 6 years, like we are treating patients with homeopathy only, cosmetic patients. So we do homeopathic mesotherapy, we do homeopathic medications, and like results are there. We usually post the result. We take patients' feedback, like how they actually felt after going, through the procedure. Result we compare also, and people come to us when they don't get the results from other doctors. Okay, so that is why they come to us. So as I said, in certain cases, melasma or even hair thinning, sometimes they don't get the results through other medicines. So with homeopathy, internal and external, uh, really good results. And as I said, we have
Okay.
already posted that. So whoever wants to see the results, so like how homeopathic mesotherapy works and how homeopathic medication gives the results. So that is there. And you cannot even compare. I mean, like if you see certain, maybe I think you must have heard about chemical peeling or
Ah,
hydrofacial, these kind of treatment you have heard, right? So
yes,
if you
ma'am.
compare, like homeopathic procedures are giving much better results than those procedures.
Okay,
Yeah.
ma'am. Could you briefly explain that
Yeah.
how this cosmetology course is taught and designed for homeopaths, and what are the skills and treatment covered in this?
Yeah. So as I said, cosmetology is about skin and hair.
Hmm.
Okay. So skin concerns, as I said, so acne scars and melasma and pigmentation, uneven skin tone, dry skin, oily skin, open pores. So this is what like is it comes under the cosmetic treatments, and we have never been taught about this, and we do see patients, such patients in our day-to-day practice.
Hmm.
So we like teach the therapeutics of each and everything, whatever now
Okay.
I have told. So freckles, people don't know what medicines to give. Okay,
Hmm.
acne scars, they don't know internally what medicines to give.
Hmm.
So for everything, like even for the anti-aging, like people don't know that we also have medicines in homeopathy to, give for anti-aging thing. So most of the concern that we can treat with homeopathy, but then it is again internal plus external. We include both the things. As I said, there is homeopathic mesotherapy, there is homeopathic medifacial. Most people, I think, who are practitioners, they use the tinctures in their practice, either directly like as an external application. But like if you see, it has a lot of alcohol content, so it can cause skin irritation when you apply directly. Usually, it's been given for to treat some time for the acne or warts are there. So you give a tuja or some kind of tincture to like apply on the warts. Even many doctors, they also give for this, like, hair loss. For hair loss, they give some combination of tinctures. But even after, because I have like before even starting the course, this is what I have taken what like a problem they face while treating such patients. So if they say that even after giving such tinctures for the external application, they don't see the expected results. So they want to know what goes wrong,
Hmm.
what again could be the better way to treat such patients. So here what we do, we prepare this thing in serum form. So homeopathic
Okay.
serum we prepare instead of using that tinctures directly, and most people definitely will cause that irritation. So how to prepare tinctures in a serum form, and then you need to apply it. So it is, these are safer also. These gives better result than direct application. And so in homeopathy, we cannot do invasive things. So machines also that we use, these are non-invasive. The work of that machine is to penetrate the serum deeper. The session that we teach, no? So homeopathic, as I said, ki homeopathic beneficial. So we don't inject anything. So there are certain machines that its work is just to penetrate the serums deeper inside, which gives the results. And for hair scalp also, we do mesotherapy. So that also allows, the machine allows the the preparation, that serum preparation that we've done to deeper penetration. So this is what gives the results. Anyways, the everything, all the contents are homeopathic. We just add some base to that and prepare it in a serum form so that it will be there for long term. And people feel that at least they're using serum, because everybody, uh,
हाँ
they want कि ऊपर से कुछ लगाने के लिए दो,
हाँ हाँ हाँ
and
हाँ
they expect for hair
हम्म
also to give some
हम्म
serum, or face also they will ask you give some serum. So this is going to definitely, it is going to upgrade their practice, like because they can dispense the serum from their practice if they learn like how to prepare the serum. And like we are here to support also. So we like help them from start to end. Like after teaching the course, how to evenly set up your practice. What are the equipments that you need in the beginning of your practice? So these are all things that we teach in the practice, even like how to take the follow-ups, how to take the basic history of cosmetic patients. So these things we teach. Yeah.
I am myself learning new things. Matlab, with the advancement of homeopathy, you are not
Yeah.
leaving the roots or core essence, that is
Yes.
case checking and follow ups and
Yes,
everything.
yes, 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 yes. Because skincare, no, people, especially homeopaths, they are not aware that, what is basic skincare is. And if cosmetic patient comes, how to handle that patient. Because we were never been taught about it, no? So,
True.
so many
Huh.
questions people have. Yeah,
Many people are concerned about safety when it comes to skin treatment. How
yeah.
safe is homeopathic cosmetology, and
Yeah.
how do you compare it with conventional approaches?
Yeah, yeah. So, people always, as even in the beginning, also, I think we've discussed that people are looking for safer treatment.
Safe things. Yeah.
Okay. And when we offer, like there's a chemical peeling, there is homeopathic medicinal. So when the homeopathy words only comes, they know it is a safe. And as I said, we have been doing it since long time. So I have not observed a single case where, it has caused some harmful effect or any adverse effect. And as we are using it in a diluted form, we are making it a serum. And of course, we are not adding any chemicals to it. And if you compare the contents or ingredients of other serums to our homeopathic serums, of course, it has no any other chemicals or anything like that. So as such, there are no adverse effect. And even when we combine the serums, especially when we suggest the therapies, no, so we combine this like machines with our serum. We don't use other serums. We use homeopathic serums, which we have prepared. So machines as such, like these machines are very safe, like hydrofacial. Everybody is doing it. So as such, like machine wise also, these are safer machines. Problem that comes when, some serum which is not suitable or which has some toxic ingredients, then there is a problem. But that these are the homeopathic serums. So as such, there are no adverse effect, very safe and result wise also. If we compare equal results or I feel even better results.
Okay.
Yeah. Yeah.
As a practitioner, what basic skincare or cosmetic tips would you recommend for the students and young professionals to maintain healthy skin naturally?
Yeah. But this also, I think, when patient comes to us and if he is suffering from, first of all, like hair fall, he'll definitely ask, just recommend me some oil or recommend me some shampoo, recommend me some, if they are suffering from graying of hair, then some color or something. We should at least have basic knowledge about it. Okay. So patient is suffering from dandruff, what shampoos we should recommend. And I'm telling you that we have been using, products of like which has homeopathic ingredients in it. Because if we compare to other companies' products, and like for example, like even Bijan has a really good products of moisturizer and hair oil and shampoo. So because these has homeopathic ingredients, so these gives better results and which are safer also. And along with the therapies, it definitely gives the good results. So basics, skincare and hair care, everybody should know because even though like people who are classical practitioner, they are going to people like patient will ask them that if they are coming for the skin concern, no, so they'll ask you what should be my skincare routine because it is out there. It is everywhere on Instagram. So doctors are posting, dermatologists or cosmetologists, they're posting about it. Their skincare routine, like these are the ways, first what you should apply. For oily skin, what are the things that, we should take care for dry skin. So these are the things, just basic knowledge also we do not have. So we make sure that, teach these basic things also. So like how to select like how if patient has some kind of skin issue, especially he has a lot of open pores or comedones, then how should be that particular patient's skincare routine? If patient has combination skin or dry skin, and what products we should recommend,
Hmm.
like how to choose the company. We like, for example, shampoo. So definitely we have Cantharis, Jaburandi, Arnica in that. And we all know that it internally works and externally also if we're using some shampoo which has these content. So it gives faster results. And
Hmm.
even for the skin, same thing. Like, moisturizer which has berberis. We know that berberis aquifolium itself,
Huh.
is it gives a skin enhancer basically.
Hmm.
So if that content is there in the moisturizer, it will enhance the results. Sunscreen, people are not aware that, sunscreen also should be used, especially when they have cosmetic concern.
Hmm.
So, how to apply? These are basic skincare that usually people don't know. Students are, especially homeopaths. So, this also we teach.
Okay. Ma'am, what
Yeah.
are some of the most common skin or hair conditions you treat using cosmetology in homeopathy?
Skin and hair, as I said, it actually people get confused about skin diseases and cosmetic concerns. So, cosmetic is actually about external appearance.
Hmm.
Okay, aesthetic, what we say. Okay, these are not, I mean, these are not actually a priority concern, but still, because of today's era, Instagram era, so everybody wants to look good, right?
Huh.
So they are going to spend money on this.
Hmm.
And the concern that we are treating is like, of course, everybody wants like clear skin.
Hmm.
So they may not spend money on the disease part if they're suffering, right? If they have some hormonal issues, maybe they'll not spend money on that. But if they have some scars like on the face, they'll definitely
They'll go for
prefer
it. Huh.
first. Huh? So these are the concerns, like, acne scars, uneven skin tone. Then
Hmm.
acne scars also, like we have some limitations. So deeper acne scars we cannot treat, but that limitations I think even the conventional practice has. They also have to like combine multiple things to give the results.
Hmm.
But what I'm talking about the basic thing, at least 80% of the patients you can treat at your clinic. So uneven skin tone, melasma, anti-aging concerns like fine lines, wrinkles. These are also we can treat. And hair also, like hair for hair thinning, alopecia. So these are the concern that we can treat with the serums and plus the therapies.
Hmm.
Yes.
ठीक है. Ma'am, can
Yeah.
this specialization open up for more career options for homeopaths like skin, aesthetic practices, or collaborations?
Yeah, so we are actually trying to, to speak to multiple colleges. Cosmetology should be added as a curriculum also
Hmm.
because the people are choosing cosmetology as a career options nowadays. So we should be able to provide something in homeopathy. So like we had a talk about it, but then still at least for now, practitioners should consider this as a skill. Okay, additional skill whenever, even diet nutrition. It is not a part of homeopathy, but still, we learn that, no? Just, we want like to give better results. Or, we want keep the patient should be treated as a, sorry, should be treated holistically.
Hmm.
So we pay attention to their diet and nutrition. So same thing I would say about the cosmetology. And until higher authorities think at least about this to include in the curriculum, but at least we can consider this as a enhancing the skill and enhancing the practice. Um, See, again, I will say why people don't want to practice homeopathy is like they feel there's no money.
Hmm.
I mean, like difficult to practice homeopathy. So these are the things I want, like people shouldn't think about it like
Hmm.
this, because at Peachtree, like we have done like better than, and I think the conventional practitioners are doing. We have a staff of 15 people. So homeopathic clinic, very difficult, no? These are the things the people usually think, but that is not the case. Just with the homeopathy, you can definitely earn. You can, and these are, new ways also, which is again, as I said, it is exciting also for us when we see the results, and we get money also out of it. So, which is like everybody wants, right? So, collaboration, yes, I think people should actually. I mean, see, in homeopathy, I feel there are many narrow-minded people are there, or they just want, like, they don't want to experiment in homeopathy. So that is a problem. But I feel that is, missing somewhere. But we are trying. But at least in from our end, we should learn as a skill to enhance our existing practice, and we shouldn't leave practicing homeopathy. My aim is was that, to teach maximum students so that they stick to homeopathy. Along with homeopathy, this is what, if they feel that they cannot just earn with homeopathy, you learn extra skills, you can earn from that. Okay, because as I said, no, like for this case is like everywhere. Like, if we ask to pay 1,000 consultation, they won't pay. But if you ask 3,000 for the session, they willingly prince. Like for look, they are going to spend more. And that is the reason that, we should include cosmetic practice in homeopathy. Yeah.
Ma'am, kudos to your initiative. Matlab, not only creating employment opportunity or making it advancement in the homeopathy,
Yeah.
also thinking about from the patient's perspective also ki homeopathy is kind of safe for the cosmetic things, and
Yeah.
putting it forward to the students and upcoming homeopaths is a
Yes,
great
yes, yes.
initiative. Matlab,
Yeah.
you have taken it so long, and I think that this will go more and more and will
Thank you. Thank
come
you.
up as a conventional thing very
Yeah.
soon.
Thank you so much. Yeah.
I have taken your sufficient time, I think, but there is just one last question from you,
Yeah.
ma'am.
Yeah. Yeah. Yeah.
How do patients respond to cosmetology treatment from a homeopathic doctor? Is this
Hmm.
the awareness growing?
Yeah. So awareness, because just one person doing it, it is not enough. Okay, so I am whoever student, I think we have taught thousands of students till now. In 2020, we have started this course. So I'm encouraging everyone, whoever has learned cosmetology, like you have to put it out there, that the results, or you need to talk about it so that people will also come to know. So how you and me come to know about chemical peeling or hydrofacial? It's through because doctors are,
Advertisements of some.
yeah, they are creating the awareness about the treatments. So that is what, even as a practitioners, we also should do that, so that there will be awareness amongst the common people. In homeopathy also, there is like cosmetic treatments available. So to create awareness, because we have been doing it, and when patient comes to us, we offer them these are the treatments that we have, and we offer homeopathic cosmetology, like homeopathic medifacial. We offer homeopathic mesotherapy, which is safer and gives better results. So definitely, when they heard, like when they hear that word homeopathy, they usually prefer these kind of treatments. So just I'm saying ki, creating awareness, there is awareness right now, but it is, I feel, only one person is creating and trying to create the awareness. I'm just every time I ask my whatever the students who have gone, like have taken the course, and I know, like because if now, just to even enhance your practice. I think you know that I am like present on social media platforms. So I talk about everything. Even I'm creating awareness not just about the cosmetology, but for the other things also. So it is nowadays it is important, if you want to enhance your practice, you should be available on social media platforms, because all people are here. Okay, so everybody should have their own Instagram account and should promote the course, treatments, whatever treatments they are doing, plus results. They should talk about it. And we are going to create the awareness, not anyone else. And one more like benefit of this course, because see, the dermatologists and other conventional practitioners, they usually think that we are competent, especially when we do PGDCC and trichology, these kind of courses. No, they always come up with the things that, homeopaths are not allowed do such things. So if you do homeopathic cosmetology, no one is going to raise the question,
Hmm.
right? So this is
True.
because we are going internally, we are giving homeopathic medicines. Externally, whatever procedures we are doing, we are using homeopathy. So of course, you can like even add into your title that you are homeopathic cosmetologist, and freely you can do the procedures, which are safe also. Good thing also is about these things. There are no adverse effect. Like chemical peeling, sometimes we don't know how to handle the patient. There are
Hmm.
chances of burn. Even with laser, there are chances of burn. But with this, absolutely zero chance of going, anything going wrong.
Hmm.
So safer, plus we are giving like good results. So that is the reason I think people should think about this and can create. These are again the pros and cons that we can tell this patients why you should choose homeopathic cosmetology as a preferred treatment.
Hmm. Hmm.
Creating awareness, I think it is everybody's duty. So we are trying, and plus I think even the student should like whoever is learning about this should try to create the awareness.
I am
Yes.
myself a final year student. Before my
Okay.
vacation started, so I was
Uh-huh.
just going through this that I wanted to do some cosmetology or something related to this.
Yeah, right,
Then I
right,
got
right.
to know about all the allopathic courses, but I did not had any wish to do them. Then I
Right.
got to know about your account. Matlab, the
Yeah.
awareness you are creating is
Right, 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 right.
reaching everywhere. So
Yes.
I just want to congratulate you that
Thank you.
that students like me are getting aware by your
Yeah.
initiative, and
Yeah.
this will always be well, reach longer,
Yeah.
and all the best or congratulations to everything you are doing. Well, this is a great initiative.
Yeah, thank you.
Thank you
Thank you
so
so
much,
much.
ma'am, for
And
this.
even just last thing that maybe some must be having some questions that, who can enroll, who is
Hmm.
eligibility about the course. That
Hmm.
also I want to say ki, even students can enroll third year onwards, like third year, fourth year students, interns, and practitioners.
Okay.
So, first and second year students we usually don't take, but third year onward, anybody can learn about cosmetology. And as early as like, if your focus is to practice homeopathy in future, then before starting the practice, you should have more skills like diet and nutrition, which I always, even about that also, I always say because that is in today's era it is needed. More maximum even diseases are related to lifestyle, related to
Hmm.
diseases, related to the eating disorders. So you should be aware about the diet and like the nutrition part of it, and plus these are the things because cosmetic patient are going to increase in
Hmm.
future because see hormonal imbalance first it affects skin and hair. PCOD patient, like acne, then pigmentation and hair fall. So thyroid also, skin and hair. So
Hmm.
like you just consider any lifestyle disorder or hormonal issues, skin and hair that affects first. So few in future, number of patients will be increased. So we have a really good scope. So as like you should like a student or practitioners also as early as possible they should like try to learn about the cosmetology. Yeah,
This 2025 era homeopath should be equipped with this knowledge of cosmetology and diet,
yeah,
but
yeah, yeah, yeah.
as this is growing and patients are demanding for this,
Yes,
so
yes, yes.
we should be equipped with this. Thank you
And
so much, ma'am.
we also have to be what I again say ki what like trends are changing, right? We
Hmm.
should go according to trend. So for that also reason, yes.
Hmm.
Okay, yeah.
Thank you so much, ma'am. We are very grateful for your time despite your busy schedule, and we have been just waiting for your one call that we could arrange this session. And you had been so generous for having giving us this time. Thank you so much, ma'am.
Thank you. Thank you so much again for having me. Thank you.
Thank you. Good afternoon, ma'am.
Good afternoon.